Or pull up my live so I can look at how the screen looks.
Mm-hmm.
Welcome everyone. We're gonna do 15 GI medications. 15 pharmacology questions all over GI medications. So if you would like to quiz yourself on GI, jump into the game. It's an unlocked game, so even if you even if you guys aren't able to join before we start, you'll be able to join in even afterwards. So we'll give it another minute or two. Let some other people hop in here and go from there. Thank you for sharing live. I appreciate it. Welcome everyone. We're doing 15 medications all on GI. All on GI. Oh shoot, I think I forgot to change the question settings on here. Hold on everyone, we might need to, here, I need to change the edit. Hold on everyone, if you joined, I need to, there it is. Change all this. You're gonna have to rejoin the quiz here in a second. Sorry about that. I wanted to make every question 1 minute, so you're getting a quick preview. Sorry to everyone that joined. You're gonna, oh shoot, have to rejoin in just a second because we want more than 20 seconds. We're gonna do 15, if anyone's jumping in here, I'm not looking at the screen, but we're doing 15 pharmacology questions, all on GI medications. 15. I'm getting a quick preview of everything. Don't look, guys. Here we go. Host alive. Sorry about that. If you guys were in the thing, we have to just enter back in because I had to change the times on the questions. So there is the new game pin. I apologize for anyone who was doing that, but we wanted 60 seconds. So we're doing 15 GI medications. If you guys haven't done Kahoot before, it's kind of fun. You'll be able to join the game with the game pin, or there's an app, and then you guys can put your answers in and it'll give me like kind of a display analytics afterwards of like what everyone guessed. It doesn't say your name, don't worry. But you can go to kahoot.it or get the Kahoot app. It's called Kahoot, so there's an app for it, Kahoot app, and then kahoot.it for the website. You're always welcome to just comment, your answers as well. So we're doing GI medications. So if you guys, I don't know what you guys are studying in pharm class, or if you're prepping for the NCLEX, let me know if GI aligns with what you guys are doing. Nice, we got a lot of people coming in. Wonderful. I love this. Yeah, I usually don't get this many people right at the beginning. Everyone kind of joins as they go, which we do have an unlocked game. So if you're trying to join or download the app, don't panic. You'll be able to join at any point. This is amazing. I usually only have like 2 or 3 people to start, but we love this. Okay, we're doing 15 GI questions. We have the Kahoot. Just know too that the questions always limit me to 120 characters. So as much as I'd like to make these like really big clinical scenario questions, I had to kind of limit it a little bit with that. So just know that. Ulcers and bowel obstructions. I love it. I'm in fundamentals and working on drug classes. Amazing. Do you need a pin? Yes, the pin is at the top. 1724841. 1724841. Yeah, so stick around. This will probably take us like 40 minutes to do these questions, probably maybe 30. I don't know, depends on how it goes. And then I just got my study guide in if anyone wants to stick around and go over my new pharmacology study guide. We're going to look into that afterwards. So that'll be, we can even do some like med templates, whatever you guys want to do after our quiz. Taking an exit exam next week. Oh, perfect. Well, GI is commonly tested on, so this will be a good, quick review. All right, let's get started. Again, there is a game pin right here, 172481. You'll see it pop up here on the bottom, and then you can always join at any point throughout the game. But let's go ahead and get started. Every question has 1 minute. All right. And then this little box right here. Oops, I just moved the camera. Jeez. Has everything that's available at the link in my bio. If anyone needs pharm help, please check it out. Like I said, I have a study guide that just came out. I've put my heart and soul into it. I have lots of resources that I love to offer you guys. So fun. Yeah. So you guys, if you haven't used Kahoot, it's kahoot.it. The game pin is now kind of small at the bottom. It's 1724841. You can always comment your answer too, but it's a fun way to make everything super interactive. Okay. And this is all GI. I have a respiratory one too that we can probably do later or maybe tomorrow. And it has definitely those really like heavy clinical scenario ones. I actually have to put pictures because the questions are so long, more like case study questions too on respiratory. For GI, I tried to kind of like trim it down a bit. Okay, a 52-year-old with chronic GERD has taken omeprazole daily for 6 months. Which lab requires close monitoring? So our correct answer here is magnesium. So let's talk about it quickly. So omeprazole is a PPI, and it looks like this patient is we're getting into some chronic proton pump inhibitor use. This can lead to hypomagnesemia, which reduces your gastric activity, and that can alter magnesium absorption in the gut. So our patient, we're seeing persistent low magnesium can manifest as like muscle cramps, weakness, arrhythmias, and we need to check those levels in long-term proton pump inhibitors, okay? Liver enzymes, which is the other popular one people chose, is typically only an issue if there's like an underlying liver disease or medication-inducing liver injuries. But proton pump inhibitors are not major like hepatotoxins on their own as well, okay? So all right. KTU taking this top spot to start us off. So yeah, if you guys want to join, it's kahoot.it. There's an app, and our game pin is 1724841. I don't know if you guys can see it, but it's listed at the bottom there in black. So yeah. Let me know where you guys are at in pharm, if you guys are prepping for the NCLEX. What do you guys think of pharmacology if you're in it or you've taken it? Did anyone love it? Most people don't don't really enjoy it, but Pharm does not have to be overwhelming. It can definitely be something that you guys, take on, and it can be, very repetitive, right? Like your side effects will cause your nursing considerations, and that will be your patient education. And so you'll kind of start connecting the dots with everything. So we talk about that a lot when we do like the templates that I fill out on lives. All right. Okay, so we have a couple different here. A patient with peptic ulcer disease is prescribed famotidine at bedtime. Which rationale supports evening dosing? Okay, so let's talk about this. Our correct answer is B. Peak effect matches nocturnal acid secretion. So histamine drives this nocturnal nighttime acid secretion. Famotidine is most effective when it's given at night because it reduces that peak acid output that usually occurs overnight. So that is going to promote ulcer healing. Okay. It doesn't really significantly alter gastric motility. It specifically reduces that acid secretion. Okay. Alex taking that top spot. If you guys like practice questions, I have 175 practice tests at the link in my bio too that are very similar to these types of questions, and they're broken down into different categories like cardiac, GI, respiratory, neuro. Do you have some for peds? Like pharmacology questions for peds? I don't. Cardiac and GU. I could put like a quiz together probably. I do have a lot of questions that relate to like pharmacology in pediatric patients, and especially medications that you have to kind of alter when you have pediatric or elderly patients. So that would actually be probably a good quiz to put together, like medications across the lifespan, like in general, but pharmacology is fine too. So I kind of focus on mostly on pharmacology. I have actually taught pediatrics that, in the past, but, and on this page, I focus mostly just like on pharmacology and how that, but I do have pharmacology and pediatric questions that I could put together. So a 40-year-old with a duodenal ulcer is prescribed sucralfate. Which teaching is most important? The majority of us got this correct at C, take on an empty stomach 1 hour before meals. So sucralfate forms like a protective barrier over an ulcer. So it's going to adhere best to when you have that like exposed mucosal surface in an acidic environment. So what you really want to tell your patients, it's crucial that they take it on an empty stomach before foods or other medications. Okay. If they take it with meals, food can actually kind of interfere with sucralfate's ability to bind the ulcers, like bind to the ulcer site. And then same with antacids, it affects its ability to bind properly. And then it's usually a tablet or a liquid form already. They want to kind of specify whether to crush it or not. I'm struggling in Pharm, so I appreciate you doing this. You probably are not alone. You are very welcome. I am so glad you're here. Let me know what other areas you guys want to do next. We can always do other quizzes. I also have one-on-one tutoring. So if you want to work with me one-on-one, I'd love to have the opportunity to help support you. You guys can check out the link in my bio that you'll just kind of scroll down towards the bottom. You'll see individual one-on-one tutoring. And it just asks a couple questions like, what are you working on? Are you in a Pharm class? Are you studying for the NCLEX? So, and then, yeah, we can always do lots more of these Kahoots. I have probably pushing like 2,000 practice questions that I made when I taught pharmacology. I've been teaching for 4.5 years now. I've been a nurse for 10, and I've been teaching pharmacology for about 4.5 years. I've also taught pediatrics, and health assessment were the other two classes that I frequently taught. So, but yeah, so now Now we break down pharmacology and make it easy and hopefully manageable for you guys. All right, I see someone who said green. Yep, most people, oh, well, hold on, I was thinking green too because I saw 13 people, but it's actually 2. A patient on chronic NSAIDs for arthritis starts misoprostol to prevent ulcers. Which finding is most concerning? Let's talk about this. Reports of heavy menstrual bleeding. So misoprostol is, let's understand what the medication is. It is a prostaglandin E1 analog that causes uterine contractions and then can lead to menstrual irregularities, right? Or excessive bleeding in that case. Women in childbearing years have the potential for like that heavy menstrual bleeding, which would end up being like a red flag for potential complications, including miscarriage, like if they were pregnant, okay? But most people selected D, black tarry stools. This could indicate a GI bleed, absolutely, but knowing kind of what this medication is for, it's used to prevent NSAID-induced ulcers. So if a GI bleeding occurred, it is serious, but heavy menstrual bleeding is more directly related to misoprostol's known adverse effects on the uterus. So could be argued here. It could be argued that, 13 is more important. But again, it's kind of knowing this medication and what it's most often indicated for as opposed to some of our other NSAIDs. So I want one-on-one to prepare for the exit HESI. Yes, please. I would love to work with you. Link in my bio is the application to just fill out a couple questions for one-on-one tutoring. And then I send you an email, I respond back to it, and we just schedule our first tutoring session. You can pick out like how many you want. If you want to meet just once, if you want to meet more times, I'd love to work with you guys. If I have any future NCLEXers here, I have on March 29th an NCLEX prep workshop coming up, and it's all about how to answer pharmacology questions. And it's pretty much 2.5 hours of practice questions over high yield medications and how we address questions that we don't know the drug, right? I need to participate. In the NCLEX workshop, then go to the link in my bio. If you want to join the game, you can go to kahoot.it or get the app. And the game pin is 1724841. 1724841. 1724841. I would love to join future NCLEXer here. Welcome, future NCLEXer. Please check out my NCLEX prep session coming up on March 29th. I think that would be helpful if you're struggling in Pharm. So let's talk about this. A 72-year-old on metoclopramide for gastroparesis has new involuntary facial movements. What is the best action? 15 of you chose the correct answer, which is stop the med and contact the provider. So metoclopramide is a dopamine D2 receptor antagonist. Okay, what that's going to do ultimately related to GI is it increases GI motility. However, whenever we're affecting dopamine, think like your Parkinson's meds, some of your psych meds, whenever we affect dopamine, we have the risk for extrapyramidal symptoms, EPS. So especially in this kind of chronic use or high doses, we have the risk of extrapyramidal symptoms, EPS. So that's like your tardive dyskinesia. So we need to be able to recognize these involuntary movements. That is critical. Okay. Most of you guys kind of already knew that though. So excellent job on that. Alex holding that number one spot. Can you move the screen down a little bit so your username isn't blocked at the top? Like that? Or the other way?
Yeah, like that, yeah.
Okay.
That's how you go up.
Second. Oh, go up. Sorry, my husband's directing me on how I should move it. Better? Okay. First semester, haven't started Pharm yet, just playing along to see what I may know. We love that, yes. Test your knowledge. You'll be prepared for Pharm. Get a little review. Can I have the game pin? Absolutely. It is 1724841. 1724841. 1724841. All right, we have a cirrhosis patient on lactulose, has frequent loose stools. Why is this therapeutic? Again, for this question, I had a nice long like clinical scenario, but Kahoot limits me to 120 characters, so we had to kind of limit our question here. But when I do a respiratory quiz, I have they're like case study type questions. But okay, our correct answer is C, or yellow. 8 of you got that correct. Let's talk about that. Oh, I forgot the it. So lactulose acidifies contents, but really it's going to convert ammonia to ammonium. So it's converting ammonia to ammonium. Then that cannot be reabsorbed and it's excreted in the stools. Okay. So frequent stools indicates it's not working to lower ammonia, improving, which ultimately would be like to improve encephalopathy. Okay. So that's our correct answer, C. All right. So it converts that ammonia to ammonium. Let's see what else other people picked. Some people picked B. Okay. No, it reduces portal pressure. No, that's really like, you might have like beta blockers or something that might do something like that, but not cirrhosis, because it's just kind of converting that ammonia to ammonium, which is going to help encephalopathy. That one wouldn't be really related. Alex holding that top spot. Put my screen up some more. The little icons are blocking the question.
Oh, like it's falling forward?
Yeah, I think it fell down a little bit. Does that look better?
Just a little bit more up.
A little more up?
Yeah.
Hopefully that's a little bit better.
She's talking, like, I'll show you. She's talking about these things. Block the question.
Oh, so it needs to be up even more.
Yeah. Yeah.
That works, and now move this down.
Yeah.
You are very welcome. Thanks for letting me know. I didn't think about that. All right. Okay, cool. 9 of you got the correct answer here. A 68-year-old with chronic kidney disease is prescribed magnesium hydroxide for dyspepsia. What is the primary concern? So our correct answer here is hypermagnesemia, if I'm saying that correctly. Ultimately, though, when you have a patient with decreased renal function, excretion of magnesium is impaired. And then what happens there is it's going to lead to the accumulation and the potential for like cardiac and neuromuscular complications. Think like arrhythmias, muscle weakness. So we have to use magnesium containing antacids very cautiously in our chronic kidney disease patients. Okay. Rebound hyperacidity, which is what some other people picked, that's typically going to be associated more with the calcium-based antacids, not necessarily magnesium. Okay. So again, can lead to that accumulation and the potential for cardiac and neuromuscular, think arrhythmias, muscle weakness. Okay. So we have to be careful with magnesium in our chronic kidney disease. Why not B? So yes, magnesium can cause diarrhea, but the bigger danger here is magnesium accumulation. So this is going to be one of those things where you have multiple right answers, but what is a safety concern, right? Whenever you think about Pharm, what is going to kill your patient? What is going to harm your patient? So diarrhea is a risk, but is it a bigger risk than an electrolyte imbalance? Right? Our electrolyte imbalance could lead to cardiac issues, things like that. So what is your primary concern? That's what the question asks there. So you have to think, what is the first thing I need to focus on? Those are always tricky, right? Because they list you want to do everything, all the answers, they all make sense. But what would you do first? What would save your patient? All right, I see a couple people say, oh, I think I have a red, yellow, and blue. I'm in. Excellent. Perfect. All right, a good amount of you got this right. So let's read it first of all. A client with clarithromycin, amoxicillin, and omeprazole for H. pylori. They're on these medications. Which statement needs clarification? So our correct answer is C, or yellow. I can stop the PPI if my symptoms improve in a week. H. pylori infection disrupts the gastric mucosa, right? And it's going to cause ulcers. We typically see this triple therapy, and it involves 2 antibiotics plus a proton pump inhibitor for at least 10 to 14 days to fully eradicate the bacteria and allow for healing. Okay. So if they're stopping it before that, like 2-week period, they can have reoccurrence of it. Okay. Let's see. 3 people chose B. Again, yeah, the full course of antibiotics is crucial. Alex holding that number 1 spot. Need clarification. I have to look for the wrong answer. I appreciate you doing. You're so very welcome. I misread. Oops. I'm not sure what, Lakay, I'm sorry I missed. I don't know what you chose for that to provide you clarification, but yeah, the correct answer was I can stop it if my symptoms improve in a week, and that would need more clarification because we would need to tell our patients, hey, we need 2 weeks of this medication. Right, I'll finish all my antibiotics even if I feel better would be correct, right? They would say, I'm feeling better, but I'm going to continue it anyways. So that statement would not need to be correct. I think B was the other one that most people chose. Welcome everyone. A couple people just joined. We're doing, gastric pharmacology questions here. I think hopefully I'm messing with the screen now so that the icons aren't over the question. But a patient on bismuth subsalicylate for traveler's diarrhea calls worried about black stools. Your best response is B, this is a normal finding. Let's review more details. So bismuth compounds, they react with sulfur in saliva and the GI tract, and then they combine to make this bismuth sulfide. But anyways, what this can do is darken the tongue and the stool harmlessly, though. It's not like black tarry stools, okay? So patients often mistake this for GI bleeding, so reassure them if no other signs of a GI bleed are present that it can be harmless. All right, move it up. I know, I need to get a better tripod so it doesn't, or maybe I can pull this up like that. There we go. Okay, hopefully I didn't mess up the screen for you guys. So again, it can be harmless. The other one that people chose was C. Bleeding would present as melena or other signs. So you'd have abdominal pain. You'd have that like kind of like tarry description to it. So truly taking that top spot. So yeah, it's a normal finding in that medication. Oh, I'm missing some comments. Yes, Pepto, I might be wrong. I didn't know. Sorry, Melissa, I don't know. I think I might have missed a comment. We have a yellow, some blues. I mean blue. Yes, most people chose blue. A 35-year-old on metronidazole for H. pylori asks about drinking alcohol. Your best response is avoid. Correct answer is B, avoid alcohol. It can cause severe nausea and vomiting. So metronidazole and alcohol can actually trigger, you guys might have heard this term, it's like that disulfiram-like reaction, and that's because you kind of alter the metabolism of ethanol, which is alcohol, and then that will cause severe GI distress. It also can have like flushing, tachycardia, and hypotension. So that's the big problem with mixing these two medications. We had 2 people choose C. Alcohol reduces drug efficacy but won't harm you. That is incorrect. It can actually produce pretty severe symptoms that we just talked about. So truly holding that top spot. So this is question 11. So 5 more questions. Alcohol will harm you. Exactly. Yep. Tell me where you guys are at in Pharm. If you guys are taking the NCLEX, if you guys are in Pharm class. I had one person who's getting ready to take Pharm, so they're kind of like testing themselves before they even get there. Sometimes we get some pharmacists that stop by, some MDs that like to kind of quiz themselves. Let me know where you guys are at. Taking my Pharm HESI on Thursday in Pharm class now. Good luck to you taking your HESI. At least it's not ATI. HESI is way better than ATI. You're in Pharm, about to take an NCLEX, second semester, first semester. Yeah, Pharm always falls in those first few semesters. If you guys are in Pharm, let me know how you're liking it. Do we like it? Do we hate it? If you are taking the NCLEX, join me on the 29th. We have an NCLEX pharmacology workshop that would be probably helpful for anyone taking the NCLEX. Okay, so a client with IBS is prescribed dicyclamine. Which symptom suggests a common adverse effect? Our correct answer is B, so most of you chose that, but it's spread around here a little bit, so let's talk about that urinary retention. Dicyclamine is an anticholinergic, okay? So that means it's going to block acetylcholine in GI smooth muscle, and it'll reduce kind of like spasming of that muscle. However, anticholinergic side effects, things are going to be dry mouth, blurred vision, urinary retention, constipation, and tachycardia. Right? Remember the things like I can't see, I can't pee, I can't spit, those things. So we had a couple people choose D, so expect like tachycardia with anticholinergics. And then C, the rapid bowel movements, you'll typically see like the slowed GI motility, constipation. Keep moving it up. Okay. I'll try to do that to make the answers. That's best I can do there. Any tips on ATI Pharm? ATI is challenging. ATI likes to test you on the nitty-gritty details, which I don't even feel like the NCLEX does. When I think about the NCLEX, I think about, think like a nurse, not like a pharmacist. However, ATI does tend to test you on details that I don't personally think you need to know. So what I would do is focus on what is going to kill my patient, what is going to harm my patient, and if there's anything unique about a drug. So an example I love to use is like amiodarone. Well, when it comes to any antidysrhythmic, we put them on an EKG, we monitor heart rate, we monitor blood pressure, we educate our patient on that stuff. But amiodarone has like a whole slew of adverse effects unique to that drug. So in that case, you would memorize everything about that drug, right? You'd memorize all those unique aspects. Other than that, study it as a class, connect the dots, try to realize how a lot of different things apply to a lot of the drugs in a same drug class, okay? What's going to kill your patient, what's going to harm your patient, that's what you're focusing on. And then as a method of teaching or studying, teach the material. So get a whiteboard, I have medication templates you can utilize, and talk out loud. Right? Talk out loud, explain it out loud, just like I'm explaining things to you right now. Explain it out loud to your dog, to the wall, to family, whatever you can. Okay. A cirrhotic patient with esophageal varices receives octreotide IV. Which best explains the effect? The correct answer is A, lowers portal blood flow. So let's talk about this. So octreotide is a somatostatin analog that reduces portal circulation, okay? It's going to decrease the pressure in that esophageal varices and then lowering the bleed risk, okay? So that is why it lowers that portal blood flow. It lowers that bleeding risk. Other things that people chose, we had people who chose, what is that, D? Vasodilation of hepatic arteries. Vasoconstriction in that splenic circulation really is the mechanism. Okay. So it's actually vasoconstriction. But it reduces that in the portal, right? It reduces that splenic portal circulation and then decreases. Does that make sense, right? So it's going to reduce that splenic portal circulation, which will then decrease pressure. But overall, that vasodilation of the hepatic arteries, it's really vasoconstriction. All right. So yeah, for studying, going back to your question on how to prepare for, I would teach the material out loud and then focus on drug classes, all the drugs within a drug class and specifics. If there's a medication that has a specific, know that. But other than that, you're studying it as a drug class, you're teaching it out loud, and you're focusing on what's going to kill your patient, what's going to harm your patient, and what are you going to do about it as the nurse. Okay. And that's why we had that question earlier. What was it? Like the medication caused diarrhea and then it caused cardiac issues. Both were correct, but obviously the cardiac or it was electrolyte balance actually, was the more important one. All right. A traveler with IBS and mild hepatic encephalopathy is on rifaximin. I think I'm saying that wrong. Which statement is true? Our correct answer is B. We had 6 of you. Oh, we had a tie between B and D. It reduces harmful bacteria in the gut lumen. So this medication is a non-absorbable antibiotic that stays in the gut. So what it's going to do is it's going to reduce ammonia-producing bacteria. This is helpful in hepatic encephalopathy, just like we talked about lactulose. It does kind of their same thing there. So it's going to reduce ammonia-producing bacteria and other GI pathogens. So that's why our correct answer here is B. The other one that people chose here is D. Acidifies colon contents. That's actually the mechanism of action of lactulose. Remember I said they end with the same thing, but if we know the mechanism of action, this is describing rifaximin, not lactulose. Okay. So lactulose will acidify colon contents, and rifaximin is going to be a non-absorbable antibiotic that stays in the gut. It's still reducing ammonia, right? But it's reducing that ammonia-producing bacteria. Kiwi has a streak of 7 correct and truly is holding our top spot. 2 more questions left, 14 and 15. And then if you guys are in Pharm class, stick around because I'd love to show you my study guide that I just launched yesterday. So I got my hard copy in the mail today. I had an older copy that I've used on previous lives if you joined me. It's very similar to what you saw today if you were in my live today. But if not, stick around because I'm excited to show everyone if you are in Pharm class. The study guide, I think there's a lot of nursing school study guides that cover like your entire nursing school experience, which is hard to do in one book. And there's usually just like a couple pages dedicated to Pharm, and it's very specific. But this one I think is going to take you not only through your Pharm class, but all the way through the NCLEX. What is the code? It is 1724841. 1724841. All right, okay, so our correct answer here is A. We had 4 of you choose that. A chronic kidney disease patient taking aluminum hydroxide for reflux has low serum phosphate. What is the explanation? So our correct answer here is aluminum hydroxide stops phosphate absorption. So aluminum hydroxide binds dietary phosphate in the gut, reducing its absorption and we commonly see this in our CKD patients, okay, as a phosphate binder, but that can ultimately lead to then hypophosphatemia, right? The other one that everyone chose was B here. It increases phosphate excretion in the kidneys. It's not via the kidneys. It binds phosphate in the intestines, right? We have one more question. Yeah, we have one more question. So the what made this wrong is by the kidneys, right? It's the intestines. Sorry, I'm fixing the screen. You guys get to see my kitchen. So the little icons don't cover the question. How long ago to the start? Do I still have time to join? This is our last question, Megan, but I'm going to hang out on live and go over my study guide that I have. So I also post this on YouTube. So check me out on YouTube. It's Pharmacology for Nurses, the exact same username. And you can go back and see my cardiac quiz, the respiratory quiz, and then now probably tomorrow I'll post the GI quiz. So see a couple greens for the answer. I think I saw some blues as well. Let me know what you guys, for those of you who have been around for most of the questions, what you think about these. Are these too hard? Are they confusing? Are they easy? Let me know your thoughts on the questions, because I like to get a gauge of how everyone feels about the questions I create. A post-op client receives ondansetron. Which mechanism of action correctly explains its antiemetic effect? So our correct answer here is C. 5 of you got this correct. This is it blocks serotonin receptors. So to be more specific and chemical, right, it's a 5-HT3 receptor antagonist. It's essentially a serotonin receptor antagonist. So it blocks serotonin in the chemoreceptor trigger zone and vagal nerve terminals. What's going to happen is when you block these in the CTZ or chemoreceptor trigger zone, it prevents that emetic signal that triggers nausea and vomiting. Okay. So a lot of people chose D, stimulates alpha 2. That's more going to be like clonidine type medication. Okay, not an antiemetic. Oops. There we go. Sorry. I like the questions and how you explain every question and every answer. It's so helpful. Oh, good. You had hard questions today. Oh, dang it. I second guessed myself. Please explain this one. No, let me know if you need more explanation to this. I'm happy to go into depth on the other ones. They were great. Good. I'm so glad you guys liked them. These might be hard because I had to cut out a lot of the clinical scenario aspect of these questions because, I came in last, but first semester, no pharm class, 4,000 points isn't terrible. No, it's not. Not at all. Ondansetron is for nausea and vomiting. Think like Zofran. I'm on the podium. Good job. Truly took our #1 spot. Good job. Perfect. Sorry, I really banged around my camera this time, and I need to get a better tripod set up to do this. I've tried it on my iPad. I've tried it on this. I'm still figuring out what the best way to do this is, but guys, please stick around with me. I want to talk to you and show you this that I have spent the last probably like 9 to 10 months going over. I can answer any questions for you guys. Oh, look, GI, I just opened it up to that. This is the Pharmacology for Nurses study guide. It's available in digital. We sold out of our pre-order for hard copy this afternoon, but this is the digital. You can get this for digital, and we'll probably have another hard copy available soon-ish in the future. But it's 200 pages of drug classes and high-yield drug medications. So we just did our GI, so antidiarrheals, antacids. Here we go, serotonin receptor antagonists on dansitron. Okay, so this has everything you need to know. It'll take you through Pharm and through the NCLEX. If you guys need a good pharmacology specific study guide, obviously I love this. I created it to exactly kind of like what I would do or I'd want my students to know. So it comes with everything from your mechanism of action all the way down to your patient education with everything that you would need to know. Okay. And then my favorite part in the back is not only, and it's a lot of different categories. Again, it's 200 pages. So there's antidotes, there's herbal supplements as well. I know those kind of get forgotten. Infectious disease, so antivirals, antibiotics, HIV, TB, malaria meds. Will this guide help me with ATI Pharm or just in general? I think it would help you with ATI Pharm. I've taught class at schools that use ATI and at HESI, so a lot of my background is guided towards what I see on exams, both through ATI, HESI, and other pharmacology courses. So I have tailored this material to what I see most frequently tested on in all of those platforms. So I think it would help with any type of like testing. And then my favorite part of it is the case studies. So there's 15 case studies. They come with 3 questions each. So a multiple choice and 2 short answer for you guys to write out, and then all of the answers and rationales for it. ATI is rough, yes. So it gives you kind of like, and it's all in the high yield commonly tested on medications. So you guys just saw the heparin and now opioid. These are medications that I see commonly on all of the testing, all of the educator materials that I've been privy to. This is what I see the most. And then at the end, it's all pharmacology test taking tips. So different types of questions. So like a priority NCLEX question. We did one of those today, a side effect recognition example. A patient education example, and a contraindication and interaction example, the most common pharmacology type questions. So, and it kind of goes over like how you would answer each of these types of questions. So if you're interested in a pharmacology guide, I would love, so a hard copy, we kind of sold all of our pre-orders, so I can't promise you when a hard copy would be available, but you could order like the digital copy now and then print it, and then obviously as soon as I get the availability to do more pre-orders for the hard copy, I will definitely be putting that out there. But so I love that study guide. Yes. So this study guide, the digital is $39.99, so it's $40. And then the hard copies go for $54.99, but again, they're not available right now because we sold all of our hard copies. I only ordered so many because I wasn't sure how popular the hard copy would be, because you know, with shipping and people usually need them right away. So the digital copy is $40. It's 200 pages of your drug classes, high yield drug information, and case studies and pharmacology test taking tips. So, and then let me know, just comment down here if you guys like want hard copies. It gives me a really good reference on like what that kind of demand is and if I should order another set of hard copies. Because I just, you know, I didn't want to be stuck with 300 of these if nobody wanted hard copies. So, yes, I want a hard copy definitely. Okay. So yeah, I will order some more, hard copies, and I will get those hopefully to you, available in the next week or 2. Cause I think a lot of people would like hard copies of this. I'll wait for the hard copy. Okay. Yep. We will definitely try to make that available. I would love a hard copy, but would there be a separate fee if I did get a digital copy first? I'll wait for hard copy, yeah. Will be a separate fee. Yeah, so if you purchase the digital, then you'll have to go back and do the hard copy, but I'll probably put out some promo codes. So come back to my lives. I like to put out promo codes, check my stories. So if I do have a promo code going on, you can at least grab that if you decide to go back for the hard copy as well. So yeah, it looks like definitely people would like hard copies. So I will get on ordering some more. We had a bunch of people pre-order them already this afternoon. So we ran out, but I will get some more, and then hopefully if we do another order of hard copies, it probably won't get shipped to you guys until probably early April. So that's the waiting time for me to get all of them, is about 2 weeks or so. So how do you pre-order? I can't pre-order them now because I already sold out of my pre-order, but I will open up another set of pre-order. Definitely follow me, and then just check my stories and my posts. I will announce that, and on all my lives, of course, I will announce that as well. The digital one we can possibly, yeah, so if you wanted it like right now, you can go get the digital one, and that's $40, and then you can definitely take it to Staples, and they will actually make it into a spiral bound too. And I think that's actually fairly affordable to do that, going to Staples and having it bound. I think they charge maybe like $15. So it would end up being the same as like the hard copy anyways, because the hard copy is $54.99, $55. So yeah, so this is everything. And then I also have the medication template that I designed it to go with. So I was doing this on my lives if you guys joined me. This is the medication template that I created, and you'll notice that they're meant to go together. So for example, you open up here to like laxatives. You have your drug class, you have your generic name, you have mechanism of action, you have indications, side effects, contraindications, nursing considerations over here, and patient education. So these were designed to go together, so that you guys, if you guys have to do these in Pharm class, you can fill these out to study, you can turn them into class, and then you have the study guide that will directly help you fill them out. So where was that medication template when I was in nursing school? I don't know. I wish I had it a while ago. I wish I would have started doing some of this more, but I was just a intro nursing professor trying to figure it out myself. What is your typical schedule for lives? Unfortunately, I don't have a set schedule. I have young kids at home, so every time I've set a schedule, I've ended up kind of missing them. So definitely set notifications. Evenings tend to be best, afternoons and then evenings. So I would say anywhere from like 9 to 11 Mountain Standard Time, and then usually 8 to 9 p.m. in the evenings Mountain Standard Time. So if you want to join my lives, turn on notifications, because then it'll pop up that I'm going live and you guys can join in for the Kahoots. We fill out these med templates. Let me find one that's filled out. So like here, I was doing these on my lives. We have like loop diuretics, right? And I filled this out on a live. And then you could come over here. We could find our cardiac section, and we could find loop diuretics. Okay. And then that's kind of what you would have. How do I pre-order a hard copy? Unfortunately, I sold out of the pre-orders because I only ordered so many to start. But I'm going to open up some more pre-orders once I talk to the printers tomorrow. And so turn on notifications and check out my story, and hopefully I'll have more pre-orders available tomorrow. But right now we sold out of our pre-order hard copies. They'll ship to you probably early April. I just want to make sure that once I pre-order another batch, that you guys will still get it April, and I have like a anticipated delivery date for you guys, and that they can handle that. But yeah, I kind of figured people would want hard copies. You never know, right? And then I was going to have like 300 study guides at my house. So, but yeah, this is what it looks like. And again, it's meant to go and pair with this, with the medication template. This was another one we were doing today. Sabas are short acting. We did an expectorant, guaifenesin. And then, yeah, you can come in here, find your medication. We can come here and find our expectorants. Oh, what am I doing? They're being respiratory. And you'd find your expectorants. Here it is. So now you have a matching template and you have the study guide to go with it, and you can kind of test yourself. That's one way I think would be really good, is you have the template, you fill it out, and then you can test yourself with the study guide. So yeah. But I will open up some more pre-orders. We sold out of all the hard copy pre-orders, so I'll talk to the printers and get another set if you guys are interested. The digital copy is available right now, though, if you wanted to have it immediate. And I think the second round of pre-orders will probably ship early April as well. And I'll try to get that up and going for everyone tomorrow. So this is the study guide, and this is the workbook. There's also herbal meds. Yeah, so it is herbal supplements here. Echinacea, garlic, ginkgo, St. John's wort. This is one that commonly comes up. And then another favorite part here is the case studies. So there's 15 case studies with high yield medications. So these are the meds that I commonly see on exams. So diuretics, and then there are the answers and rationales here. Warfarin, there's one on heparin, antipsychotics, tocolytics. So you guys will get a chance to kind of like practice your medications after you fill out your templates and do short answer. So organized into all the different categories. And then on meds that I see, like levothyroxine, on meds that are tested on a lot, some of them got their own page in addition to like drug classes. So there's 200 pages of either high yield medications or drug classes. So yeah. It's all available at the link in my bio. And then before I hop off, so you'll find the study guide there. You'll find the template, the workbook there, one-on-one tutoring. If anyone's interested in working with me, I'd love that privilege to work with you guys. And then if I have any NCLEXers, check out my workshop, which is on March 29th. The digital copy, I'd be able to pay and get it within an hour or so. Yeah, it's immediate. You should get it within like 2 or 3 minutes of paying. So you'll do the checkout, and then you automatically get like a confirmation email. And in that confirmation email is your downloadable PDF. Okay. So yeah, you'll get it immediately. So yeah, I have the NCLEX workshop on the 29th. I have one-on-one tutoring. This checkout, set some notifications. I will have another round of hard copy pre-orders for you guys tomorrow. And then, yeah, message me with any questions, and I will see you guys on my next live, probably tomorrow afternoon.